Hey ladies, sex after baby. There's a lot of questions we have, but sometimes we don't have the courage to ask, how long do I have to wait? Why do I have to wait? What happened to my pelvic floor? And what happens if I don't feel like returning to sex? We'll cover some of those today. My name's Heather Marr, and I'm a pelvic floor physical therapist, and I've seen many women over the years. And the big question sometimes is sex after baby. So let's jump right into this. So you have done an amazing job, new mom, especially if you're in this new postpartum period of the first 6 weeks after delivery. You have carried this baby for 9 months or 40 weeks, give or take a few weeks, and now you've delivered, whether it was a vaginal delivery or a C-section delivery, and you are amazing. Now your body needs to rest. So if you have an abdominal incision or you've had a tear to the perineum right in here, regardless of that, whether you've had a tear, no tear, or you've had stitches, the pelvic floor needs some time to rest and heal. And that's why we really want to give it typically 6 weeks before you return to sex. Now, what you're waiting for is your doctor's approval to assess the pelvic floor, your abdominal incision, make sure there's no infection, that the bleeding has stopped, and then that you're allowed to return to sex. Now, at that 6-week visit, when you're cleared, you're given the green light. But are you ready physically? Are you ready psychologically? Those are some other things to discuss and really consider what's going on. It depends on your birth story. If it's been traumatic and there is some fear to returning to sex, this is a good time to reach out to a mental health therapist, somebody that you can talk to and process through maybe this fear and anxiety. So don't dismiss this. If you're feeling that way, it's okay. Don't blame yourself. Don't feel like you're a bad person. That's important to address as well. Now, maybe sex is not really appealing right now, and that's common because there's fatigue. You're a new mom. Your sleep schedule's off, and you're trying to rest and heal. And fatigue really decreases your sex drive. So that's number one. 2, you've got hormones surging and changing and everything, especially if you're breastfeeding and the estrogen has dropped. Your desire may decrease, as well as having some vaginal dryness. And 3, you've had some body changes. And right now, new mom, congratulations. I know you're not feeling it necessarily, but when you look at your body, celebrate what your body's been able to do. This is not the time to diet and get back to that pre-pregnancy look. Just looking at your body and appreciating what you've gone through is a big key. So ladies, what do we do while we wait for the return to sex? When you're in a relationship, when you're trying to connect with your husband, intimacy is important during this time. Let's not just focus on intercourse or sex. Let's talk about intimacy. Right now, what you may be needing, what your partner may be needing, is that connection, that way of physically being close, hugging, kissing, positive words, affirmation. Each of you have gone through a big change. It's affecting you as well as your husband. You've got a new role. So encouraging each other through this new challenging time of fatigue and trying to figure out how to take care of baby and take care of you. So intimacy is such a big important part during this time. Now here are 3 tips to remember as you return to sex after the doctor gives you the green light to return. 1, if there's pain, don't push through the pain. There could be some tightness here along this where you've had a tear or where the tissues have stretched, or you've had an episiotomy and there's some scar tissue here. You don't want to just push through that. You want to, just like we did some scar massage, or maybe you did some perineal massage in pregnancy, we need to work on this area. Now, I've worked with lots of women that have just grit their teeth and cried and put their face in the pillow, and that's not our goal with sex. Sex should be pain-free, but also enjoyable. Now, if you feel like you're having some discomfort, go ahead and check out seeing a pelvic floor physical therapist. We specialize in this area. We work on this so that we can see what is involved with the pain. 2, if you're having vaginal dryness, this could be contributing to some of your pain. Now, don't be surprised if you've never had dryness in your past and you've never had to use a lubricant. Again, the estrogen drop can contribute to some of the vaginal dryness. So looking for a good lubricant is really important, but not all lubricants are the same. I really like Slippery Stuff, which is available on Amazon. It's a water-based, and you want to make sure that it doesn't have the parabens or the glycerin, anything to irritate this pelvic floor area. So be very careful about your lubricants that you buy, but you do possibly need to have one. I know that for me it was important when I returned to sex after having my 2 babies as well. And tip 3, communicate effectively with your partner as to what is enjoyable. Things have changed and it feels a little bit different. One way to talk about this is the pelvic clock. So up towards the ceiling or your belly button, that's 12. Down towards your butt is 6, 3, and 9. So if there is pain or discomfort or, oh, I really enjoy that spot, communicate using the pelvic clock, because the communication is really, really important. And again, enjoy this time together and don't dismiss that you've had 6 weeks of not connecting to your partner or your husband. Remember that there's intimacy. And again, if you're having any pain, reach out to talk to a pelvic floor physical therapist. And if you're having any fear or anxiety too about returning to sex or processing your birth story, talk to a mental health therapist. Again, all these are simple tips to help you as you return to sex after having baby. Congratulations, Mom, on this new chapter of life. And it is beautiful. There are some challenges, but there are some amazing things as well. You're not alone.